So let's go ahead and continue looking now at the urinary system. So when we're looking at the urinary anatomy, we're really talking about the kidneys and all the structures associated with the kidneys. So what we have two kidneys, one right, one left. Now notice that the one on the left is slightly elevated relative to the one on the right, and that has to do with the orientation of the liver relative to the stomach, and the fact that the liver is going to be slightly inferior in terms of its right lobe of the liver. Coming away from each of the kidneys, we will have a ureter. The ureters will lead into the urinary bladder, and the urinary bladder will lead into the urethra. If we're to look at the kidney itself is going to be a structured organ. The structured organ is divided into various areas. It starts with the hilum. The hilum is going to give rise to the medial depression. The medial depression is where we have what's referred to as the renal sinus, and we'll take a look at this in a picture here in a second. Inside the renal sinus, we're going to see all of the blood vessels, the nerves, the lymph vessels coming in and exiting, as well as the ureter exiting. Within the sinus, we will notice that we'll have structures that are going to be coming away from the cortical regions into the ureter, such as the calyxes. And the division point between the filtration tissues and the collection tissues was referred to as the papillae. Histologically, we're going to have distinct cells based off of the structures that we're looking at. So in the nephrons, we're going to see both simple squamous as well as simple cuboidal tissue. They're going to have varying degrees of permeability, and that varying degrees of permeability is going to dictate the overall function that those cells have. Outside of the nephrons, we're going to have what's referred to as extranephronic or extratubular cells. These are predominantly going to be cuboidal epithelial cells. In the glomerulus itself, we're going to be seeing a cluster of simple squamous cells. These are impermeable cells that are going to form what's referred to as a slit membrane that's going to surround sinusoidal and fenestrated capillary beds that form the glomerulus itself. So let's take a look at the gross anatomy of the kidney here. When we look at the gross anatomy of the kidney, we start with the capsular structure, which is the most outer layer. Just deep to the capsular structure, we will get to the renal cortex. Within the renal cortex, we will see the corpuscles, as well as some of the nephronic tissues. And then we get to the renal medulla, where we're going to see more of the nephronic tissues. In between the capsule and the pelvis, we're going to have structures there. And the combination of the cortex and the medulla in between the renal columns forms a structure known as the renal pyramids. The renal pyramids end at the renal papilla, and the cluster of the renal papillas around the medullary region of the kidney itself is going to form the renal sinus, where we're going to see all of the calyxes and pelvis structures. The functional part of the kidney is within the pyramid, where we're going to see the glomerulus and then the nephron. Coming away from the papillary membrane, from the renal papilla, we're going to get the minor calyxes. The minor calyxes will junction together to form the major calyx. The major calyx will junction together to form the renal pelvis. The renal pelvis will then exit through the hilum of the kidney, forming the ureter. The calyxes and pelvis and ureter are an impermeable layer of tissues that are highly inelastic. They don't stretch. That inability to stretch can become problematic for people who have excessive dehydration, as it will lead to issues of moving of excreted urine that is desiccated, dehydrated, due to the formation of what is usually referred to as calyxes or stones. The way in which the kidney functions is based off of the way in which the nephron functions. The nephron is the functional unit, and overall, just like what we saw with the liver, it's all about blood flow, because what we're doing is we're going about involving filtration and movement of materials in between the vascular flow and the excretory flow. And so we have to understand how blood is going to be flowing, and by understanding how blood is going to flow, we'll be able to determine the overall functions. So as it happens, we go from the renal artery to the segmental artery. The segmental artery leads to the interlobular artery. This is going to head up the pyramids and then across the pyramids. And then we're going to get to the arcuates. The arcuates are going to cut in between the cortex and the medulla. These are going to lead to the intralobular arteries, sometimes referred to as the cortical radiates. These are going to head out from the border between the medulla and the cortex, out into the cortex, and head out to the individual glomeruluses. From the coronaradiatic arteries, we're going to get the afferent arteriole. The afferent arteriole is going to lead to the glomerulus capillaries themselves. The glomerulus capillaries themselves will lead to the afferent arteriole. The afferent arteriole is going to lead to the peritubular capillaries and the vasa recta that surrounds the nephron itself. This is going to lead to the intralobular vein. The intralobular vein is going to head to the arcuate vein. The arcuate vein is going to head to the interlobular and segmental veins. The interlobular and segmental veins will junction together to form the renal vein and exit through the hilum. Please note that what is being filtered is arterial blood, not venal blood. So just like what we saw with exchange in the alveolus, it's flowing from arterial side to venal side in terms of flow, unlike what we saw with the liver, where it's a confluence, a junction of artery and vein flow within the liver. The filtration will take place at the glomerulus, and the reabsorption is going to take place in between the nephron and the peritubular and vasa recta vasculature. So let's just take a quick look at histologically what we would see within the kidney itself in terms of the organization of structures that we'll see. And so we have what's referred to as the corpuscle region. The corpuscle region is going to have the glomerulus within it as well as all of the surrounding tubular structures. The corpuscle itself is not the filtration area. It's the actual anatomical region of the kidney that houses the glomerulus and the tubular structures that surround it. Just outside of the glomerulus, we get a region of tissue known as the juxtaglomerular tissue. It's this area, the juxtaglomerular tissue, that is responsible for the endocrine responses that we see coming from the kidney itself, whether it is EPO regulating erythrocyte production, or if it's going to be regulation of nitrous oxide and renin in terms of vascular pressure. Notice how we have a boundary point in between the cortex and the medulla, and you can see how the tissue drastically changes in terms of its organization and its orientation. Notice how we get that lighting change as we head towards the papillary area. That's where we're starting to get more of the collecting tubules and collecting ducts. And so notice the change of structure in terms of the organization around the tubes and around the networks, where up in the cortex, we are highly vascularized, and we start to lose that vascularization as we head medially towards the medulla within the kidney itself. Note the structure of the collecting ducts relative to the proximal or the distal convoluted tubules, the P and the D indicated on the histology slide around the glomerulus. Notice the open spot around the glomerulus, which is going to be the indication of Bowman's capsule. And so in the next segment of stuff, what we're going to do is we're going to go ahead and look into the functional unit of the kidney, the pyramid, and how the nephron is organized so as to allow for it to function the way it's going to function.